Hi, my name is Michelle Civello. I'm a family nurse practitioner at North Oaks Health System. I'm here today to talk to you about a topic that's very near and dear to my heart, especially in the last couple of months. I'm going to talk to you today about crisis fatigue. It's a hot topic in the media today. I've read plenty of articles on it, and it is a symptom that I see quite often with some of the patients that I've been taking care of lately. So crisis fatigue is tiredness, lack of interest caused by long-term stress. And we've had a lot of that in the last couple of months. 2020 has been laden with multiple occurrences that have caused stress in our life, beginning with COVID-19 and the infection, our new norm of wearing masks, how are we going to take care of ourselves and our family, fear of catching the virus. Also, some people have lost their jobs and others have had a big change in their job role from working in an office or a facility to working at home. And so we're all going through how are we coping with working in the home at the same time as managing our normal family activities and taking care of our children who are now home from school. So a lot of us have worked from home since the beginning of the year and managing how we can find that time with taking care of our responsibilities from work, as well as now homeschooling and finding activities for our children so that we can keep them occupied and distract them from what they're not used to. So a couple of things, we've had a lot of stress with hurricanes and flooding and social unrest, and so many different things have caused a lot of stress in our lives today. So I want to talk to you about how the stress response affects our body. So our body is a fine-oiled machine when it comes to dealing with stress on acute situations. For instance, let's just say you were driving your car and all of a sudden somebody pulls out on you, your heart starts beating, your respirations increase, and you're like, whoo, wow, that was almost an accident. In a normal situation, your body levels out, you start feeling better, your heart rate comes down, your blood pressure comes down. So when dealing with stress, that's how the body is meant to react, and that's a normal reaction. When we are dealing with long-term continuous stress, what happens is your body releases hormones, and the hormones that the body releases are cortisol and adrenaline. So how that increase occurs is the stress stimulates the hypothalamus to release a chemical communication to the adrenal glands over the kidney, and the kidney releases cortisol and adrenaline. So adrenaline is a hormone that increases your heart rate, it increases your blood pressure, it increases your respiratory rate, it prepares you for flight or fight. The cortisol is a hormone that releases glucose from the cells and the stores of your body so that you have the energy to be able to prepare to fight or flight. What happens is when your body is subjected to continuous stress over a long period of time, chronic stress, certain physiological things happen that our body has a hard time dealing with. And when those hormone levels remain elevated, it can cause chronic conditions in us. So some of the things that you may see when you have long-term stress is diabetes, hypertension, depression, anxiety, eating disorders. Some people even develop drinking and using drugs to help cope because their body's not used to this abnormal stress and their coping mechanisms are being taxed at this point in time. So what I would like to talk to you about today are some of the things that have helped me tremendously in dealing with all of the factors that we've had to deal with since the beginning of this year. Most importantly, I try to take time out for myself every day, whether it be 5 or 10 minutes. I do deep breathing exercises a few times a day. I try to make sure I'm eating a healthy diet, rich in fruits and vegetables, lean meats, and I make sure that I'm drinking the water that I need to drink every day. The deep breathing exercises are really helpful as well. Establishing a routine is very beneficial in helping you develop your coping mechanisms. All of those things that I've just mentioned help build your immune system so that if you are exposed to any of those stressors underneath illness or fatigue and depression and anxiety, that immune response help build you up so that you're better able to cope. So I challenge you today to incorporate some of the coping mechanisms that I have discussed with you today to help improve your ability to cope with the stress that we experience in our daily lives and to help prevent the effects of crisis fatigue from affecting your long-term health. 1, make sure you carve out that time for you every day. Take care of yourself. 2, make sure you're getting enough sleep. 6 to 8 hours a night is what we're recommended in getting sleep. It will help build up your body so that you can fight the next day. 3, making sure that you're eating a healthy diet, rich in vegetables and fruit. And 4, getting the exercise that you need to alleviate some of the stress that you have in your daily life and to help build up your body and help it protect itself from long-term stress. So if you do find yourself in situations like this, I challenge you to use those coping mechanisms. And more importantly, if you find yourself in a situation to where you are not able to help yourself, please contact your primary care provider and get the help that you need in order to take care of yourself. Thank you.